And get started. Hopefully, a few more people will jump on. But welcome to Speak. I'm so glad to have Amy here with us. I met with her probably a couple months ago um, to talk about bridging apps, and it just is an amazing resource that I think will benefit all ages and stages really of life. And so, super excited that she's here to share more. So, thank you, Amy.
Of course. And I just froze, so I hope that doesn't mean that our Wi-Fi here is glitching, but if it does, I will turn off my camera, and I will be sharing some things. So yes, thank you so much for having me. I'm going to share several different online resources that we have and kind of help you out with some ways to find apps and things like that for your loved ones. So first of all, Bridging Apps is a program of Easter Seals Greater Houston. We have 11 different programs now, and 12. We have a partial one of a 12th. And we provide services for all ages and all abilities. So we're really, really fortunate that a lot of our services, you don't have to actually prove that you have a disability, which is really helpful because we serve a lot of people, older adults who are aging in place. Of course, those older adults with disabilities that have grown up with us and received our services for years and years. And we just help them with lots of different kinds of things. We do have a veterans program. We do free mental health counseling for the veterans and their family members, which is amazing. And a lot of those families also end up discovering some of our services for, their children and relatives with disabilities. And so we are able to serve them also. Um, the program that I'm with is Bridging Apps. Just to tell you a little bit about Bridging Apps, it started when our program director, who is one of the co-founders, she and another parent were in a support group for children with disabilities in a therapy clinic. Her son was born with Down syndrome, and he also has a diagnosis of autism and a cortical visual impairment. He just has a lot of sensory issues and things like that. So lots of needs. And they were in this support group around the time that he's 21 now. So to give you an idea, this was 10, 11, 12 years ago. When the iPad was first coming out, they started seeing that their children could do a lot of things with these touch screen technology that they could not do on a traditional computer with a mouse. And so they started getting iPads and trying out different games and things like that. And what they discovered was that a lot of these games that were meant to be fun were actually helping with learning other skills. And of course, they were all delighted that their children are able to do things without having the cognitive load of using a mouse, understanding that what you're doing with the mouse is happening on your screen and all of that. That direct touch screen really cut out a lot of difficulties for some of their children with using technology. So they started compiling a list of these apps that they found that were helpful just to share within their group. And the other co-founder, his name is Sammy, he's a tech guy, and we kind of jokingly say there's always a tech guy, right? And they're like, I can just build a database. And that's what he said. I'll just build a database and store all these apps for us. So he did that. And then it got so big that they were going to make their own nonprofit. And Easter Seals found out about us and took us in and wanted us to become part of them, part of their technology program. So we do a traditional assistive technology and then all of the services of Bridging Apps also, which is mostly mobile technology, although we're all kind of trained in lots of different options out there. And if someone wants a traditional assistive tech, we do that also. So what I'm going to show you today is what that database has become. And let me get my screen open here. And you'll have to forgive me because we use Teams mostly. And so I get a little clunky sometimes with Zoom and remembering where everything is. So it takes me a little bit longer now that I don't do it as often. Make sure I share the sound in case we need it. And we're just going to share the whole screen. Okay, so this is our main website. Although we're part of Easter Seals Greater Houston, you can find us on the Easter Seals website, but we have our own web identity because of all the things I'm going to show you. We would just take up all of their space if we use their website. So bridgingapps.org is our main website. Everything I'm going to show you is connected to this. You can get to it from this main site, so you only have to remember one address. The first thing I'm going to show you is the app search tool. And you can get to it from here. You can also scroll down. You can see there's app database and a button here for app search. If you go from the top menu, you just go app search and then find an app. And then you will see a new nice search bar come up. It is very intuitive, very user friendly, and that I don't have to teach you how to use it. You all can probably figure it out on your own, but just to walk through some of the features of it, you can search by keyword or diagnosis. So we do, because we work with so many different populations, we do, app lists for different needs. So we have lists for Down syndrome. We have lists for children with Down syndrome, for adults with Down syndrome, all those different, different age groups and different needs. So you can search there. You can also just start perusing the different categories. We have different tools for all these different needs. We have a lot of former teachers on our team, and so a lot of us think in this way. If I were in a classroom, I used to be a special education teacher. If I were in a classroom, what kind of tools might I be looking for, based on what their needs are? So we have tried to think of all the different ways that different people search, professionals and caregivers and parents. You can look up AAC, you can just go to learning tools, all of these different things. We do have the ability to filter by platform. We always tell everyone if you are an Android user, to filter that first because just the nature of the app game, I guess, is that a lot of app developers develop for Apple first and then they will make an Android version. So what we don't want is for people to be on our site and find an app they just love and they want to try and then find out that it's not available for their device. So we tell people, please filter out, especially if you are an Android user, or maybe you only have a laptop and you want to use web applications. We have that ability also. So, what we've done here and what makes this app database special, there are about 2,400 apps in it right now. We have not created any apps on our own. All of these are apps that we go out and find and decide to review them. A lot of them are apps for special needs that we saw. We have an AAC category, so you're going to see things like Proloquo, all of the different communication apps. We do have those, but a lot of our apps are actually what you would consider mainstream apps, like the gaming apps that I was talking about, and we review them and think maybe outside of the box of even how the developer intended for them to work. So, to show you one of ours, let's see, I think I will show you. This is a good one. This is one of our director's favorites. Um, so you see, I just typed in, I knew the name of the app, so I just typed in the name of it. This is called Simply Saying Medical Jargon. And just to show you how the app reviews work, I'm going to use this as an example. Um, so you can see when you open up the app review, it's going to have the exact icon that you see in the App Store. We are actually directly connected to the App Store and to the Google Play Store. So we're really lucky in that a lot of this information updates automatically. So the app icon that you're going to see, the price will update. If it has in-app purchases, it will say that under the zero because a lot of developers now, it's free to download, but then once you start using it, you have to pay for it. So we will note that on there that yes, it's free, but it has in-app purchases. The developer's website, you can go and check them out. This update date is really, really neat. This is actually the last time the developer updated the app. And I'm going to contradict myself because a lot of times I will tell people you need to really look at this date and not download it if it's super old. So this one is about 3 years old, a little more. Um, in this situation, because it is a completely free app, and because we know who it was developed by, which it says Media Cube, but honestly, it was developed by Children's Hospital. I think when we open it up, we can see that I can't remember which hospital, that it was created by a Children's Hospital. So another, nonprofit kind of situation like we are. We know that the app is really good, and we know that even if it does start having some glitches, you're not putting any money into it, so it's kind of safe. But if you're going to put money into an app and they haven't updated it in the last 3 years or more, I would be very hesitant to do that. So this is just another way that we educate our users. The official app means that we reviewed it, and of course, the supported platforms. This is the one downside of this one. It is not available for Android. So every month, we have some Texas Children's Hospital residents that come in and do training with us. And one of them had an Android and he wanted to download this immediately so that he could use it with patients. And he could not. And he was very disappointed. So, all of that information to help you. We do have a direct download button. If you click on that, if I were on my phone or an iPad right now, I could go directly to the App Store and download it. We don't track any of this. We don't keep track of it. We don't make any money if you download it. This is another just convenience for our users. So we have the review. In the review, what makes us special is that all of our apps are reviewed by someone who has experience with disabilities. So as an agency, about 40% of our staff at Easter Seals either has a disability themselves or are a direct caregiver of someone with a disability, which is really amazing. I'm very proud of that, actually. So, a lot of us are not only caring for maybe a child with a disability, but we're also caring for aging parents. I happen to have a grandparent that is 95, and I am still her caregiver from a distance. So, we are all in that kind of situation where we have a lot of experience with disabilities and different needs. So we have teachers, former teachers like me, special education, regular teachers, everybody in between, just general ed. We have therapists, a lot of PT, OT, speechies, all those therapists, and we have a lot of just users with disabilities and their caregivers that are also reviewing these apps for us. So they have to do that. They have to have some kind of legitimacy before we will let them just review apps. The other thing is we do not take any money from developers. So developers really now contact us all the time and say, I saw your website. Can you put me on it? I want some attention, through your website. And what we tell them is we will not pay for it. So if it costs anything, they have to give it to us for free, give us a code to get it. And that we're very honest and that they might not like some of the things we have to say. We explain to them that we're reviewing through the lens of our community, and they are our first focus. And what happens usually, and it's really, really interesting, we've got a lot of relationships going now with developers where when we don't like something, they say, well, how can we fix it? How can we make it better for the community? How can we don't want to offend anyone. We don't want this to not be usable for them. How can we make it more accessible? How can we make it better? And so we've really gotten the opportunity to teach a lot of people that know nothing about disabilities, a lot about disabilities. So that's a really kind of added bonus. That we've been able to have that influence. So what we do is we talk about who we used it with. Part of this was reviewed by our director because she uses it all the time with Vincent. And then we also have some examples from other people who have reviewed it for us. So we talk about who we used it with, what the situation was, what their needs are, how we used it, and really how did it work? Was it great? Were there some problems of that were really some parts of it that were really difficult to use or didn't work as they said, all of those things. Again, very honest. We also give examples of other people, other populations of people that it might be helpful for. Professionals that may be able to use it, things like that. So everything we do is really focused on helping parents and caregivers know what they don't know because you can't help it if you just don't know something or you don't know something's out there, to help educate them and to make things easier and to save them time and money. So when we have an app that costs money, especially, we are very, very careful with how we review that and make sure that we give all the ins and outs of it because we don't want someone to spend money and then it not work for them, or for them to find that something we said about it was not the case, not what they experienced. So that's the review. We do contribute to a podcast that is hosted by Easter Seals in Indiana. It's Easter Seals Crossroad. They do a really amazing podcast. And so some of our reviews will have this where you can just listen to the review basically through SoundCloud, because this is where we have added it to their podcast and you can listen to it on there. So that's kind of neat too. Great way to hear the review instead of reading it. Um, the first tab is the review, like we were talking about. The stars mean that we've reviewed it and this is what we thought about it. This is an amazing one, of course. It gets 5 stars. The description is what the developer said about it. Oh, Phoenix Children's Hospital. I'm going to give them credit. That's who developed it, and it's actually their child life specialist. So it talks about how you can use it. I like to tell people, especially if it's an app that you're putting money into, to compare what we said about it and what the developer said about it, because a lot of times the developer is trying to sell it to you. The Down syndrome, I'm sure as part of the Down syndrome community, the autism community has this problem also where people want to develop something and put autism in the term so they can sell it to parents because they want to make money off people who are looking for solutions. And so we like to say, compare what they're saying because maybe they're just trying to do a really hard sell to you, and some of that stuff might not necessarily be true. So it's a great way to look at the app from two different views. This one is really honest because again, it was created with great intentions. They're not trying to sell you anything, just be helpful. This is the really cool part. This is the same media that you're going to see on the App Store or on the Google Play Store. And this is the way I'm going to show you a little bit about this app, just so you understand how it works. It's honestly, I feel like it's best on an iPad, especially if you're using it with a child or a young person, just because the pictures are easier to see. So it has all these different areas. It has pictures, real pictures of different things that they might see if they're going in for a medical procedure. That's the purpose of this app, is to kind of prep someone for a medical procedure, help with, quelling some of the anxiety. In Vincent's case, even having a blood draw is very, very difficult and confusing for him. It's stressful. So Kristen uses this all the time with him. So it has different little recordings of the sounds and things the machine might make. Those machines are loud. You want to prep them for that. This is my favorite part, though. It has all these different drawings of body part areas. And you can actually, down here, you can choose the colors and you can actually draw on it. So you could say, like, even if they weren't having something internal done, like maybe they messed up their shoulder or have something they need to get done, and you can draw on there and say you're going to have a little bandage, in this spot, and kind of getting them ready for what to expect. It has a lot of different drawings and things in there that would apply to pretty much everything. Again, just this is what it's going to look like when you have to get in this hospital bed. This doesn't look like what I have at home, so it might be kind of weird to me when I walk in if I've never seen one. So all these different ways you can prep them. It has a lot of information in it, dictionary, different ways to explain things. All these hyperlinked things will go to images and more explanations. So just a very, very helpful app. It's amazing that it's free because it does have a lot of stuff in it. You can see here in the glossary, you can just touch on different terms. And then if it has a little paintbrush near it, that means that there's also a photo with it or one that you could draw on, like we just saw in the other one. So lots of different things. It is available and also in Spanish, which is really helpful. And so, yeah, so this is how the app review works and the purpose of it. The user feedback is where users can actually go and rate the app. So you can see the little stars fill out when I'm hovering over them. I am signed in. You do not have to be signed in to do anything I just showed you. All of you can look at it right now. You don't have to create an account. We're not going to bug you. We don't have to track you and all that kind of stuff. Everything is free. Nothing is gated. What is available if you sign in is that you can rate like this on the user feedback, because obviously we don't want a bunch of bots just coming in and rating apps and messing up, the process that we use and the integrity of our reviews. You can also save your own app list and save searches. So for somebody like Whitney who works with, a certain group, a certain population, maybe she finds a lot of apps that she thinks might be really helpful. She could create a list and then send it out to the group. The person you send it to does not have to have an account. They just click on the link and it takes them straight to it. If they want to save it themselves, then they would create an account. But you can see some of the app list I have saved here. The neat thing is you can not only create your own app list, but you can also save some that we've already done. So if you search and you find our Down syndrome for adults list. I can't remember exactly the title of it, but it's got those two words, it's got those three words all in it. And if you find that list and you're like, oh, I really love this list, I want to check out some of these apps, then you can save it to your account and then you could share it with other people. You can also edit it. So if I go into this low vision apps, I could delete if I'm like, oh, I tried this and it's awful. I don't like it. I'm not saying that about that app. I don't know this one, but just as an example, you can just delete it off of there. You can also add more. So if you are just searching around and you find an app, then you can just click add it to list and choose which of your list you want to add it to. So lots of different ways to save and to share apps and for this just to be useful for you. The other thing is saving searches. So as a teacher, I would always have searched for the same thing over and over again. My daughter also has dyslexia and dysgraphia, which is a great combination. If you know any of those tools, they're really yeah, they're not fun. And so I would be searching for, she was diagnosed in third grade. I would have searched for things for elementary dyslexia to help her out. And then when I click on that saved search, it has all of my filters that I created when I was looking. So the neat thing about that is that maybe the last time I was in here, it does them newest to oldest. Sorry, I skipped saying that. It does them from newest to oldest when you go in and click on your save search. And so maybe the last time Learning Ally was at the top. But now MDA of Oz and Lexico are also there. So what that tells me is that these apps are either brand new, were just added to our database, or they've been updated. Well, I know that MDA of Oz has been around for a while. So it must have just been updated by the developer. So I might want to check that out. Lexico is not even reviewed yet. It's so new in our database. So it's just another way to kind of help you out with searching and finding things that are new. I like the save searches just because I think it's a great way for professionals, especially, or someone who's caring for, somebody with very specific needs to be able to save all those filters and not have to do it every single time. So I just have dyslexia here. And I had done it by age, I believe, but you could go in and I could make it where it was only iPad or only iPhone or whatever. Specify that search even more. So, let's see. The other thing, let me go back to my Simply Saying example. Um, So the way that you can share the list and things like that, like I was showing, you can also just share the app itself. And again, you don't have to have an account to be able to do this. We've tried to think of every single way. It's very interesting because as the app database grows and we make changes to it and our clients get more technologically savvy, we find a lot of clients really just want us to text them a link. So if we're searching for apps with someone, we just copy the link and put it into our phones and text them. The website is not an app itself that you can go and download, but what we do for our users is we always try to go through how to make a shortcut on their screen of their smart device. So if they're searching for it on their phone or their tablet, then we will make a shortcut on the screen for them so they can easily get back to it and access it that way. So it is a web-based only app. That is about everything about the app database. Like I said, is very user-friendly. We do have the language translation. One thing about the language translation is what it translates is, of course, everything on our site. You can read the reviews in whatever language you want to. We just try to, caution people, let them know that just because you can read that review in Spanish doesn't mean the app is actually available in Spanish. That's kind of a totally different part. So what we do with our English second language speakers is that we, help let them read the reviews and things, and then we try to help them find out, well, can we find this in the language that they need if they like it? So just a little note about that. But the language translation works pretty well. Okay, so that is most of the. Do we have any questions? Has anything come in the chat? I cannot see the chat. Just make sure nobody has any questions about the apps before I move on to the other parts.
Nothing has come in the chat yet.
Okay. And I didn't get the chance to ask because I know the first person you said was on the board. But are there any parents here or caregivers that want to share the age of the person that they care for? Just so I kind of have an idea. I'm going to show some things for transition age students.
Mine will be 4 in November.
Okay. Oh,
Mhm.
so tiny. Mine's
Mhm.
been so long since my kids were that little. Anybody else want to share like who they're caring for? I know we only have a few people on here. If you want to, just pop it in the chat. It just gives me an idea of who I'm talking with. Okay, so that is the app database. Let's see. Oh, we have one that just turned 18. Oh, you have to listen. You're in the right place because I'm about to talk about some transition age stuff. I am going to show you our YouTube channel. I'll come back to that at the very end because, again, it's very user friendly. You guys can figure it out if we run out of time. I don't want to miss this. So, coming from the main website, we have two different resources that one of them is very, very new. The other one we launched in October of 2018 to really help with transition age and young adult and adult people who are caring for adults with disabilities also. So from our main website, if you go to services, and then this second one is the family transition tool, Texas Youth to Adults. I already have it open, but I just want you to know how to get to it from here. When you go to it from here, it actually gives you a little blurb about it, explains what it is. We received this grant through the Department of Health and Human Services, Maternal and Child Health Care department. When I started in 2018, we were wrapping up and launching everything. It was a 3-year grant. And what it is a one-stop kind of resource place for everything transition. So they recognize that the doctors cannot give you all of the information you need. The schools cannot, and a lot of times don't, give you all of the information you need. It's hard to find where are we going for independent living resources? What about employment? What if the school didn't prepare them for what we want them to do after high school or what they're interested in after high school? All of these things. There was no really one-stop kind of shopping place. So that's what we developed. So this just explains how we did it. We did work with the Baylor Transition Clinic for, y'all are not in Houston, but here in Houston, we do have a clinic who specifically serves those transition age who are coming from pediatric care into adult care to keep them from falling through the cracks. It's really, really amazing. So we worked with the main doctor that runs that, and then also with Texas Children's Hospital. So we had some medical professionals helping us there. So when you click this, it will take you to it. This is what, oh, sorry, I'm on the wrong thing. Um, I didn't click on it, sorry. When I opened it earlier for you, I did not click on the actual website. So I'm going to log out here so you can see kind of the process for logging in and out. Oh, come on. Let me figure out how to use my mouse, first of all. It's not letting me log out. I have this window open so much that sometimes it will not let me log out. Let me do it in a blind window. Well, hold on, I'll do it this way. When you first go to the website, this is what you're going to see as if you are not logged in. This is why I'm going to have to do a workaround right here because I keep this open so often. I should log out of it more often, but this is what you're going to see. It just explains again how we created it, why, all the different people who had a lot of input in it, and it helps you to create an account. Now, again, you can access all of the articles on here. With the exception of any that are marked adult content. So the internet has this rule that a lot of people don't know, where you really should not be able to access certain material if you don't prove that you're over the age of 13. So for safety reasons, there are a lot of articles that are gated if we don't know for sure that you're an adult. So there may be some things that don't show up if you don't sign in, just because we obviously did not want children tripping over adult content on our website. Not that there's anything that risque, but there are just some things you don't want your children to read or know until you're ready to tell them. So, um, it to get started, it asks you 3 questions. Those questions are This is why I was worried about my Wi-Fi, kind of having trouble here. Let me go into um, oh, yes. Now I just decided to start working. Okay. So it asks you three questions. And those questions are, who are you helping? So myself or someone else. The really cool thing about this is that the idea behind it was actually so that your children, your young adult children that, 10 to 21, really to 21 plus is who this website really helps. If they are cognitively able, they can have their own account also. And so I'll show you a few things we have that are specifically directed towards the person transitioning. So if you're a caregiver, of course, you're going to say, I'm helping someone else. Here, you just put the age of how old they are. It doesn't matter what you put. This is just part of helping you filter. Because the website technically starts at age 10, which in Texas, everyone should be talking about transition for children with visual impairments by the age of 10. Autism is age 12. And of course, everybody else, it has to be addressed by the time they're 14. So that is the way we got the age 10. Because of those recommended ages. So you can put whatever age you want. This just helps with filtering. You can choose a diagnosis, but you don't have to. So you could choose Down syndrome, but you can just skip it. You don't have to put anything. Of course, we don't keep any of this information. We don't track it. It is simply for this reason over here. And you can see that I said I was helping someone who is 10 with Down syndrome, and it has filtered those for me already. So what it does is it helps you find articles that might be more helpful for you, but you can also always clear out these check marks whenever you want to. We have about between 600 and 700 articles in here, so it might be helpful for you to filter them sometimes. I am going to also log in. So obviously I have several accounts. I'm going to log into our Bridging Apps account. And now, once you have answered those questions and logged in, this is your new timeline. So your new homepage, you'll never see that group of kids again. Unless you do like I did and you didn't take the questions the first time. So this new thing is a timeline with the different ages on it. Now, in addition to the articles that you kind of saw a little preview of when I answered those questions the first time, we also have this timeline, which is really kind of the meat of the website besides the informational articles. What it does is it gives you recommended task list for your person at certain ages. So I'm logged in as a caregiver. So right now it's showing me when it says for adults, that means for the adult caregiver. Things to do for your child during this period. The really cool thing is that as a caregiver, I can also see the same list that my child would see if they have their own account. So there are mirrored things on here. That should not say 16, 17. There are mirrored things on here for the child and for the adult. So I'm going to go back to the caregiver list and show you this one for the 14 to 15. Um, Again, we had a lot of professional input on these. We just really sat the doctors down and said, if you had a magic wand and you could tell every parent of a child with a certain age things to work on, what would you do? And so they gave us all these tasks and kind of helped us with sorting. They need to start doing this by this age. We'd like them to at least talk about it by this age. One of the things they said was, if your child is going to be on some kind of medication for most of their lives or for the foreseeable future, they need to learn how to use the pharmacy again if they have the communication skills and are able to do it. So let them practice. So one of the things I would do on this task is that I might edit it and say, we have a neighborhood pharmacist. Her name's Danielle, and she's amazing. So I might say, make sure Danielle's there that day because I know she's going to be nice to my children. I know she's going to be patient and understand what I'm trying to do. So I can edit it and make it say whatever I want and then save it. You can also just mark it off once you've done it. So maybe your child is an expert at using the pharmacy already and you don't need to think about this. Then you just mark it off completed. Again, because you created this account, all of this that you do to it is saved. There are quizzes in here. There are different hyperlinks things. This is one of my favorites because we worked really, really hard on these articles. So I'm going to take you to this one. This is an example of something that we created where there's a mirrored kind of topic for the person transitioning, but we used very different resources based on who we were talking to. So this is the one for parents. And all of our articles that we created, there's very few content that we actually went out and made from scratch. A lot of this is where we went and we found the resources and we pulled them together to try to make it easier for parents to understand why they might need that resource or how that resource might be helpful. So the same thing we do with our app reviews. We are trying to save people time and money. And a great example is if I told you that your child needs to go through a redetermination to receive SSI after they turn 18, but you need to start at least 6 months in advance. And then I said, oh, just go to the Social Security website and find it. You'll find it on there. That would be awful, right? Because you might spend 2 hours trying to find the right place to go to that. So we have cut it down where we give the exact link on where to go. So this is a really great example. So we just give a little blurb here, and then we start sharing all of these different exact links on how to get to information that you can easily access and that will help you talk about difficult conversations with your children. So that's what some of these links are on the task list. Sorry, I lost my train of thought. And again, all of these are just articles that we have, and we've also said it's important enough that it needs to be part of the task list. So again, this personal support networks, because you all are in Texas, you may know about this. Family to Family helped develop this, and it talks about how you can start your own personal support network for after you are not here, or after you are unable to care for your adult child as they age and as you age. So lots of different useful things. Again, you can edit them, you can mark them off, you can make your own task. So maybe you're like, oh, there's something I really want to remember to do when they're between the ages of 14 and 15. You can call it whatever you want, make a description, save it, and it will add it to your task list. Um, so you can see how that works. I'm going to take you to an example. Okay, this is a really great example. Um, so another thing we try to do on here is we talk to parents about things that maybe no one ever told them, such as signing up for a Medicaid waiver. I know we politely call it the waiting list. Unfortunately, in Texas, it's very long. Kristen allowed me to be with her when she called one time to check Vincent's status on one, and he was like in the thousands, and he had been signed up since he was 3. It literally took 15 years for him to be approved for one of them that he finally did get. So we have parents that come in with a teenage child, and they didn't know that that even exists. And so we try to educate people and catch them up where we can. This is another one we share a lot, the Making My Own Choices. This is about supported decision making. And again, you can see there are a lot of links in here. It does look a little overwhelming, but what we're trying to do, again, as you can see, each of these goes to an exact place. This one's even a PDF that you can just open and download to help you get the information you need without making you search forever and ever for it. We also have other resources here. This particular resource was done by Disability Rights Texas. It's amazing. This PDF is a plain language guide that helps you not only understand it yourself, but also helps you with conversations to have with your child about it. So one of the parts, let me make this a little bit smaller. It's kind of big. One of the parts says, what is self-determination? What is guardianship? What is supported decision making? And then when you go, there's like a decision making worksheet. So you can actually just go through this with your child. Sorry, that is not the right page. I don't know why that says. Oh, the worksheet is in here. There it is. The page numbers are weird. So you can talk to your child. You know what? You decided where you might want to work. You made this great choice about looking for a job in a wherever, a coffee shop or wherever it is you chose to work. Did you need help with it? Yeah, or sometimes I need help, and then who could help me? So it kind of helps you empower your child and remind them of the things that they are able to do. So maybe you don't need full guardianship. Maybe it is just as a sort supported decision making, but this guide is really, really helpful for it. I just love it. I was actually considering making one of these of my own, and thank goodness Disability Rights Texas did it because they probably did a better job than I did. But if you've ever read the legal language about this, it's like 160 pages long and it's very confusing. So this is just a great guide for parents and families. And if you're working with families, it's something great to share with them. It's 34 pages long and it's just very, very helpful. Um, so that's an example of what we do with those articles. Again, is to give parents and guardians the correct place to go without making them kind of go down a rabbit hole of all these other options. Um, that is pretty user friendly, pretty self-explanatory. Let me move this out of the way. Did anybody have any questions about this or thoughts or something else maybe that I kind of skimmed over that you want to see? No? Okay. Um, so if anyone does have any thoughts or questions or something you'd like to see more of, or you just need some help getting started with it, we do this all the time. I'm happy to walk through with you, and talk about your certain situation and kind of help you find some things to get you on the right track or things, answer questions, all of that kind of stuff. Happy to help with that. If you are just brand new or sharing this with someone who maybe just had a child with a disability, or somebody who was just diagnosed, there are some great resources as far as this what is transition. We really go into maybe, we have a lot of families who say, well, I had three other children before this child, and they graduated from high school and they went on and found their own jobs and they really didn't need me once they got a certain age. And so we do try to educate people where there's so many other really things to think about when you're talking about the needs of someone with a disability. So, we're happy to go through any of that with any people. We do have some questions here that, people kind of get people thinking like, oh, some parents will say, well, they have this specialist. They're great at Texas Children's, but they don't realize that they can't see that specialist when they're 21, that they're going to have to switch specialists. And that's very, very hard when your child has been cared for by the same team of people for so long. So just lots of ways to educate parents and to really help out making those things easier. Um, so the other transition related kind of a caring for an adult part that I want to show you is if we go back here to our main website. We got a grant to help create a user guide for consumer directed services, which some of you may be cringing now if you're getting into this spot. So, if your person has been approved for one of the Medicaid waivers or maybe more than one, those kind of services, there are decisions to make after that. So there's the decision of if you are going to be the one hiring the caregivers, taking care of all the details with that, or if you're going to let someone else handle it, like an agency or something. So what we did is we created an easy to use guide for those consumer directed services. If you go here to communities, you can see that it's listed right under families. I do have it already open. Um, and what we did is we created a video series because who wants to read a bunch of stuff when you can just watch videos of it, right? So here we explain the purpose behind it. This whole thing is not about when you are having an agency help you. This is about the option of doing it as yourself, otherwise known as the employer option. So the person with the disability becomes the employer of the caregiver of the people that are going to be in and out of the house, or helping them in the community. And so, you do have a lot more control over the services, but you also have a lot of responsibility. So these videos really break it down for you in easy to understand ways. And you can see the topics, overview of requesting and receiving services, understanding it, where does it fit into the process, what the service delivery, all these different topics to help you with navigating all of the information because there is a lot. And Unfortunately, it's just not made easy by anyone. So we were lucky enough to be able to get this, to work with Health and Human Services, to work with people who do this. It was actually funded by Aetna, as you can see here, to really help you. There is a way to download this help guide. Um, and it's just a Word doc that opens up and it has a table of contents. You can see it's 16 pages. So it will walk you through all of these things too. And we have like a family story. Someone was nice enough to kind of share their story and how they did it, how they navigated things, and it really helps you really understand the different options and things like that. So it's a great little user guide. Um, and then we also created an app list because how can we not create an app list? Because that's what we do, right? So this is all right here as part of our website. We've had a lot of excitement over it. We were able to create it all in Spanish also, which is very exciting. So you can see all of the same series in Spanish. I do believe that part of the written part may not be in Spanish, but all the videos are available in Spanish now. It seems like there's one part that is not yet translated, but this is very, very new for us. Just in the past year, we've done it. So I think I might actually have a little bit of time for questions. Let's see. Oh, I want to show the YouTube channel really quick too, and then we'll chat and ask questions. So the other thing I want to show you, just because it is just really amazing. We have this wonderful thing called YouTube, and we have all these videos we are able to post on it. So here at the top where all of our socials are, you can see YouTube is the last icon. Our YouTube channel, we have about 500, oh look, 515 videos right now. And the really special thing about it is that we do a lot of what we do on the websites, but of course it's easier to access when it's in video form. So there are some things where you can do, like here, you can see this video is about different apps for writing. This our Tick Station is an app, features to help people with executive functionings, all these different kinds of videos. But we do these great playlists because there are so many videos where people can just look for different things they're interested in. So email basics, we have a lot of people come in that just, there's nowhere you can look at how to find, how to navigate your email, how to attach photos, things like that. So those kind of things are in there. These are our CDS video series I just showed you. So you can just go to YouTube and see them. Actually, I think I'm signed in as admin here. So let me switch that account and make sure that, yeah, I don't think you can see them actually when you're not signed in. Yep, sorry about that. That was a back end feature. I was signed in as the admin on there. Had to switch to myself. So for the playlist, the one I want you to see though is this Did You Know playlist. This is a really great one to start with. A lot of your children, if they're like mine, they probably know technology better than you do, and they figured a lot of things out. But this series in particular is really helpful for people with different needs, because what we did is we took everything that comes installed already on your smartphone or tablet, and we made videos about it. So these are the things people ask us all the time. How do I enlarge the font on my phone? The great thing is we not only talked about the feature, but we made matching videos for Apple and Android. So it's very different what you're going to do on an Apple phone than how you're going to change that on an Android. Because we have so many former teachers on our team, we have a really great formula. I don't mind bragging that we have a great formula for creating these videos where we use screenshots. We use simple language. If we have a screenshot, you can see here, she has the settings icon circled. We mark exactly what you need to touch on the screen. We talk through every single step of how to activate something, if it's an app, how to download it, how you can turn it on, and then all the different ways you can use it. So if you are an iPhone user like me, you know that if you go to an accessibility settings, there are so many options in there, and it's really hard to know what you need or how to get to the feature that you need. So if you're just enlarging the font, she's showing you exactly where to go so you don't get lost in those accessibility features. We have 35 videos in this now, which means that there is an intro video. So there are 34 content videos on here. So there are 17 different features or settings that we've covered because there was one for Android and one for Apple. So certain things like Apple has voiceover, Android calls it something different, but what we've tried to do is find those matching features for each device. So just a great, really thing for you to go through, look at, learn something about your phone. My husband is really funny. He saw one of our videos shared and he was like, I didn't know you could do that with your phone. And I'm like, yeah, well, you live with the person that probably came up with the idea to make that video. So, you just don't know because our phones can do so many things. So we really are proud of this video series. A lot of our older adults love it because they can watch a video over and over again. They can pause, rewind. They don't have to keep asking questions about it and feel like people are getting annoyed or aggravated with them because it's taking them longer to learn. They can just do it on their own, and that gives them a sense of pride that they learned something on their own. And also they can always refer back to it if they need to on how to change something and things like that. So just lots of different things on here, even just rearranging the apps on your home screen. Android has an option where you can make a larger keyboard, those kind of things. So just something free I wanted you to see. In addition to our other resources, we do have, I'm going to stop sharing now so I can see all of you. We do have all the social medias, and a lot of this stuff, when we first create a video, we share it on our social media. So if you follow us on Facebook or Instagram or we even have a Pinterest board, then you're going to see a lot of these videos as we create them or as we share them. So that's pretty much it. Look, that's great timing, and I don't feel like I had to talk too fast. Are there any questions or any thoughts or comments or something if you are doing consumer directed services and you see this series and you're like, wow, what about this thing? And there's something helpful we can add to kind of tell people like, oh, you could also do this. We can always share it out in a blog and say, also, this might be helpful when you're doing this because we don't know everything. We just, try to help as much as we can. I don't see any questions. Nothing in the chat. Whitney, anything else or anything you saw earlier that I might have forgotten to share or cover?
No, I think it was great. Gave a great overview and yeah, makes me excited to keep exploring all of the resources that you guys have. Thank you so much for doing that. It's really helpful for our families.
Yeah, of course. And I'm just going to put my email in the chat. You can email me and just, if I don't have time or can't talk through something with you because I do a lot of presentations, I'll pass you on to one of my coworkers. And, again, we're happy to just talk through any of these resources and help people get started with them.
All right. Well, thank you so much. We really appreciate it.
Of course. Thank you so much for having me. Please let me know if there's something else I can help with.
All right. Have a good day, everyone.
Okay, thanks. Bye.